Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Types of urinary duplication. There are two types of urinary duplication. One, we have incomplete urinary duplication, and second, we have complete urinary duplication. Incomplete urinary duplication. In incomplete urinary duplication, in incomplete duplication, we have this is the kidney, and from the kidney we have the lower pole. A ureter comes from the lower pole, and one more ureter comes from the upper pole. The ureter coming from the upper pole will in incomplete duplication, both these ureters, the ureter from the upper pole and the ureter from the lower pole, both these will join together and they form together one ureter, and this will drain into the urinary bladder. So this is incomplete duplication. Whereas in complete duplication, in this, first there is a ureter. This is the kidney. A ureter comes from the lower pole and one more ureter will come from the upper pole. So the ureter from the lower pole will be actually the ureter from the lower pole will drain like this. Okay, sorry, I'll do this again. The ureter from the lower pole will drain into the urinary bladder, whereas the ureter from the upper pole will drain into the same urinary bladder more medially and more downwards. That is more medially and caudally. The ureter from the upper pole mainly drains into the urinary bladder more medially and caudally, whereas the ureter from the lower pole will drain into the urinary bladder upper in the upper part. So this is called as Wiegert-Meyer rule, which is seen in complete duplication. In complete duplication, we have a Wiegert-Meyer rule. According to Wiegert-Meyer rule, it is seen in complete duplication. So in Wiegert-Meyer rule, the upper pole of the ureter and the lower pole of the ureter will rotate on the long axis, so that the upper pole of the ureter is medial and the upper pole of the upper pole uretary orifice is medial and caudal to the lower pole uretary orifice. So this is important. Next, the upper pole uretary orifice become ectopic. So the upper pole uretary orifice can become ectopic and it can get obstructed, whereas the lower pole ureter is lateral and it is short. Because the lower pole ureter is short, it can result in vesicoureteric reflex can occur in the lower pole ureter because of the short ureter. Whereas the upper pole ureter is ectopic and it is obstructed. Because it leads into a shorter intravesical tunnel, it results in because it forms a short intravesical tunnel, it results in vesicoureteric reflex. So lower pole is associated with vesicoureteric reflex, whereas upper pole ureter is obstructed. And one more thing, upper pole ureter is also associated with ureterocele. So these are the two types of duplication of ureter.
thank you and thank you for watching.